and I know we're still letting people in from the waiting room, but a lot to go through this morning, so I'm going to get started. And Cassandra is going to help me out by moving through the slides. So maybe if we can just move to the land acknowledgement slide, Cassandra, that would be great. And this is a practice that we've begun doing on a more regular basis, and it's important for us to be able to reflect on the land that we have the privilege to live and do our work on. And so this morning, I want to start with the acknowledgement that the land on which we find ourselves in GRH and that GRH sits on today is the land traditionally used by the Haudenosaunee, Anishinaabe, and Neutral peoples. And we also acknowledge that there are enduring presence and deep traditional knowledge and philosophies of the Indigenous peoples with whom we share this land. And as I say, you will hear land acknowledgements at the beginning of more and more meetings and functions by GRH, not simply to read the words, but hopefully to allow us all the opportunity to spend a little bit of time reflecting on the land that we get to enjoy and the history behind how we come to be here. So with that, let me move into our presentation, and I want to acknowledge a couple of things that happened the last couple of weeks or so. Last Thursday marked the first National Day for Truth and Reconciliation, and I hope that you were able to spend a little bit of time reflecting on our country's history, and some of that being a very sad history, and maybe educating ourselves a little bit more on what I would say is a very troubling history for our nation and for our First Nations in particular. If we look at this month, which is on the next slide, we're this month is LGBT History Month in Canada, and I know that our Pride Working Group is putting together some great resources that will be shared in GRH Now, and I would encourage you to look for that and read that, and it's again important for us to continue to build our knowledge and information around diversity within our community, within our province, and in particular within our own organization. This is also Breast Cancer Awareness Month, and I think as many of you know, battling breast cancer, my mom's battled breast cancer, is what brought me to healthcare. So this is a month that I, for sure remember Mom, in a very fond way, and although it's been well over 20 years, continue to miss her presence, her physical presence, but always aware of her being there with me. So before I get into the formal part of the presentation, and I thank those of you who've already sent in questions that you had to our communications group, and we will attempt to answer most, if not all, of those today. But in addition to that, if you wouldn't mind just using the chat function, enter questions that you have today. And as we get toward the end of the presentation, I will turn it over to the communication group to read back some of those questions, and I or other members of the senior team will try to answer them for you. Okay, and another question that I would have for you on the next slide, which is, what are you proudest of today? And again, use the chat function. I think that it's always easy to look at the things that are challenging us, and they always seem to draw our attention. And I would encourage all of us to first take a moment to say, to think about what is it that we're proudest of. And as I begin my day, one of my thoughts of what I was proudest of is just how hard everyone in our organization is trying to work together to make positive change. And although we might not see that every single day, I get the great opportunity to be able to see that happening in different parts of the organization, and that's something that I'm quite proud of. So moving to the next slide, which is another point of pride, is actually the letters and the kudos that we get to see from different patients. This one in particular, really struck me as a great representation of our value of care and our value of courage to start, heart to finish as an organization. And it describes how our regional cancer program stepped up to help patients from London when their cancer services went down because of a flood, and how we met the expectations, but I would say really exceeded the expectations of people coming here, and how we stepped up to help them in their time of need. So my thanks and my congratulations to our team in the regional cancer program, because you really did exemplify the values of our organization. So thank you for that. So just moving into this morning's agenda, and as I said a little bit earlier, it's pretty packed. So I am going to try and move somewhat quickly through each of the items so that I can make sure that there is time for your questions and answers towards the end of it. So let me start with the celebrating our accomplishments. And a couple of things this month, we're celebrating Medical Devices Reprocessing Department, and they get a week, even though that they're here 52 weeks of the year, providing great support to our organization. And I'd really like to extend a special shout out to them, as well as this is also Occupational Therapy Month. And so to those two teams, thank you for everything that you do, and the positive impact that you're making in people's lives every single day. A couple other things that we can celebrate is our MRI project, which is by far one of our greatest risks in our community, is moving ahead. And so we will be replacing a 17-year-old plus MRI machine with new technology before the end of this calendar year. And so that is great. And our entire project, which includes nuclear medicine, is continuing to move forward with different phases of ministry approval. And our latest estimate is probably by mid next year, the entire project would be complete and up and operational. So that's fantastic. And our facilities team and our finance team and others have been working really hard on identifying a different solution, which will require much less capital spending to still provide a safe solution for parking. And you'll hear more and more about that in the weeks ahead. But that is something that's great as well. We also, we're celebrating our 125th anniversary, and our great friends at the foundation have issued a Care Never Stops 125th Anniversary magazine, which is a look back at the history of the organization. And it's also a look at some of the significant accomplishments of our organization and where we're heading. And it's a commemorative piece that highlights those stories. And it is something, when I had an opportunity to go through it, really brought a lot of pride, about our organization and a pretty interesting history as well. So my thanks to our friends at the foundation for doing that. In addition to that, our 2020-21, so the last fiscal year, our annual report is being released, and you'll see more about that this week. And I would really encourage you to take a look at it. It doesn't take long to go through it, and it provides a pretty good summary of everything we've been through in the last fiscal year, and draws attention to the great work that you have been doing individually and collectively to support our community. And my thanks to all of you for that. And again, this is something that I would encourage you to take a look at, encourage you to share it as well. because it is about the great work that you've been doing. So moving on, some of the things that we heard from you about what you want me to cover today is talking about our challenges around staff morale, our significant number of vacancies and what we're doing to try and address those, talking a little bit about our staff retention plans, talking a little bit about the KW pension plan, and there was a question about digital strategy and some of the, or actually multiple projects around digital and how we're addressing those. So I'm going to try and address all of those as I go through this, but let me start first with our current state around COVID-19. Continues to be moving in the right direction. There's 128 active cases in our region. We have less than 5 admitted patients with COVID-19 today, and less than 5 staff who are currently off because of a COVID-19 infection or exposure. And that having been said, I can also say that although we've opened, well over 130 new beds since the beginning of COVID-19, we are jam-packed. And I know that is putting added stress on all of you, on the entire organization. And I know that our emergency room is seeing record volumes. I heard about our peak day, I think it was around 260 visits to our emergency room. And to put that into context, our emergency room is designed for 170 people. So we are trying to work on different strategies to make sure that there is awareness throughout the community of the challenges in the hospital now and of alternatives that are available out in the community so that people can get the care that they're seeking in the right place. So moving on to what I know is top of mind for some in the organization, which is our COVID-19 vaccination policy. And let me start by thanking the well over 90% of our team members who are fully vaccinated. And we will continue to provide the information and the education that others need. And I want to assure you that this isn't done from a position of being punitive. This is done from a position of really wanting to minimize risk to those who work in our organization and those that we care for in our organization. And on the next slide is this is pulled from the Ontario Science Table, so evidence-based. And this came about a week ago. This is updated, their dashboard is updated every day. But I thought it was a good depiction of what those risks are that we're trying to mitigate. So as you can see, those who are unvaccinated have a 760% higher risk of becoming infected than those who are vaccinated. And the risks of being admitted to an ICU are 76.2 times higher than someone who is vaccinated. So this isn't about knowing that we will eliminate all infections if we're vaccinated. No vaccine is perfect, and nobody in our organization is saying that this one is perfect. However, we are saying, based on the science, based on the recommendations of medical experts and of infectious disease experts, we are confident that the approach we're taking around requiring vaccination to work or provide care in our organization is the right one, and is the one that we are committed to sticking with and moving forward with. So moving to the next slide, just a reminder for those that and I think everybody is aware, and everyone would have seen the communication that came out yesterday, that we are recognizing that a number of people have taken the step, the first step, and have now received their first dose of the COVID-19 vaccine and hadn't before, and they will get their second dose sometime after October 12th. And you'll have seen yesterday, we are recognizing that and taking that into account as we move through our different steps of our COVID-19 vaccination policy. And then as of November 9th, there is that requirement that we have the appropriate information for those who have not yet provided it. And I would encourage you, if you haven't provided that information, you should be doing so. It was a requirement of the policy that was developed in response to a directive from the Chief Medical Officer of Health for the province. And tomorrow, on the next slide, you'll see a reference to a virtual vaccine education panel. And so this has some of our own medical experts, and hopefully you take the opportunity to attend at 10 a.m. tomorrow morning to hear from these experts and to potentially ask your questions of them. And this is being done with the intention of providing more opportunities for people to ask questions or to hear from some of our experts around our why for our vaccine policy and vaccines in general. So now let me move to staff morale. And last week, I shared a memo that acknowledges where we are, which is not a great place. And it's easy to say, and that's across the entire system, but that's not an excuse, and that's not a reason for why we are where we are. We recognize there's a number of challenges across the organization. Also recognize that there's been a number of changes over the past, I would say, number of years, couple of years. And some of those changes have come at a rapid pace, and not all of them, and one that was flagged for me yesterday is around our whole discharge planning process. So not all of our process changes have come without challenges or without setbacks. And that isn't because there aren't people who are trying to put a lot of thought into making sure that those changes are properly communicated, the right education is there. However, it's not going to be perfect every time. And what's important is that we acknowledge that people are trying to get it right, acknowledge that we have opportunities to learn, and then applying that learning to how we improve as an organization. And last week, I tried to share some of the ideas and some of the action that we're taking as an organization to try and have a positive impact on our current challenges around morale. There's more to be done, no doubt. And the best solutions will not come from me or the people that I get to work with. The best solutions will come from all parts of the organization, and really encourage you to share those ideas that you have through your huddles, through your department meetings, with your manager, with others that you have an opportunity to speak with and influence, because it is only through the collective action of our organization that we're going to be able to make the improvements that we all want to see. So moving to our next slide, and this is one of the key challenges that we have, and I didn't look this morning, but when I looked yesterday, we continue to have well over 300 vacancies in the organization, and are doing a number of things to try and address that. I know that we're looking at where we've been historically recruiting for temporary positions, now looking at making those full-time positions and making them more attractive to come to. I know that we're holding a virtual fair come the beginning of November, which is I would say an all hands on deck type of recruitment effort for our various vacancies throughout the organization. Also reaching out to people who have retired from our organization and doing much more around our recruitment efforts. And there's a working group that's looking at different approaches for us to be taking, including making sure that the brand and the opportunities of our organization are much more widely known. And the Ministry of Health, to their credit, has also come out with some incentive programs and additional programs for recruitment. And we're looking at all of those with an eye to how do we maximize our utilization of them. And I just spoke about our vaccination policy. We know that there's some departments that will experience some challenges as we move through our dates in that policy. October 12th is coming, and there is active work happening in the various programs to make sure that contingency plans are put in place, additional recruitment efforts are occurring so that we can minimize the impact of enforcing our policy, and that is what we will be doing. And most importantly, as you see on the next slide, is around staff retention. And so it's not just about recruitment, it's also about retention and making sure that we honor our commitment for this to be an excellent place to work or practice medicine as an organization. And there's a number of initiatives that are being worked on. Here again, there's a group that's specifically focused on it. You're going to hear more about this in the coming days and the coming weeks. And really at its core is about recognition and saying thank you. And although we try to do that on a regular basis, I and I think everyone else on the leadership team would say we can never do it. We can never say thank you enough, because every single minute of every day, there are great things happening in our organization and great people making sure that that happens. So here again, although we have ideas, and I know that the team is reaching out to people at the front line to get more ideas about what we can be doing. And we have great support from our friends at the foundation around this as well. Please do share your suggestions. I know that our comms team would love to hear feedback around what are some of the different things we could be doing around staff retention. And some of the things that we've been doing and that I'll highlight on the next slide is around our collective mental health. And early this year, we implemented a program, or basically extended our mental health benefits beyond our current benefit program, and have recently made the decision to extend that to the end of this calendar year, when it was originally supposed to expire at the end of September. And the reason we did that is we recognize and we acknowledge where we are. And we also acknowledge that we need a more robust, longer term mental health strategy for the organization. And there's work that's happening on that right now. In addition to those efforts, on the next slide is a reminder of other services that are available to all of us, right? So our EFAP program, which is a quite robust program that offers support to you and your family members. There's also, our occupational health group that you can reach out to, and all of these conversations are confidential, and all of these services are made available to try and help you and your family members with whatever challenge it is that you're facing. Another area that I was asked about is the KW pension plan, and to be able to speak to that a little bit, I would say that over the last year, the financial position of the plan improved quite substantially. We've made a number of changes to the overall management of the plan, to the investment portfolio, and to the governance of the plan. All of those from having a positive impact. And this year, we will be doing our next valuation of the plan, which is a legal requirement, and that's something that will begin in November. And on the next slide, I speak about, you'll see a couple other things that are on here that I already mentioned. And the one that I would highlight is that the board of directors now has the pension committee reporting directly to it, as opposed to through the resources committee. And that augments the importance of this plan at the board level and at the entire organizational level. We continue to monitor our plan from a financial viability standpoint, which was identified by you as the number one important item of importance when it comes to our pension plan, and to look for opportunities to make enhancements to that plan where it's feasible. And we will continue to do so. And as we've said, our longer term vision is to be able to move that plan into Hoop, but that would be a longer term plan for sure. And it has to be done in a way that is financially responsible for the organization, the taxpayers of this province. So moving to the next slide, there was questions around our digital strategy, and I think it's fair to say that almost every project these days involves some component of digital or IT, and that really increases the importance of us prioritizing our projects, reprioritizing our projects, and aligning them with our strategic plan as an organization. And that's what our digital services team is doing. And our project management office is also making investments and augmenting our tools and our people in that department to be able to provide the overall insight and management to our various projects across the organization. And I think it's fair to say that the demands on this service are quite significant, and they're doing their utmost best to meet those demands and do so in a prioritized fashion. And there's also a longer term digital services strategy that's in the works and will guide the work over the next number of years. One of the, on the next slide is a quick summary of one of the biggest pieces of work that we're doing with our friends at St. Mary's. And Cassandra, if you can just move to the next slide. There we go. And this is around creating a joint master plan with St. Mary's. Right off the top, I want to acknowledge this is not about an amalgamation of St. Mary's and Grand River Hospital. This is about the two organizations working together to develop one master plan for acute care infrastructure in this community that is required for the future. It is obvious based on the growth that we're seeing and will continue to see in the communities that we serve, the programs we need to add, and the state of the facilities that we currently operate from. This is something that is really required for our community. These types of projects typically take somewhere between 10 and 15 years to come to fruition. So it is the right time for us to be beginning, and we are in the really early days of this project. And the next phase of this project is on the next slide, which is really looking at the options that we're exploring. The first one is to redevelop on the existing sites of the two hospitals. The second option that we're exploring is looking at how do we develop new acute care services on one campus of care. And then the third one is a campus of care for a large part of those acute care services, and then keeping another site at either the current KW site or the current St. Mary's site for other ambulatory care type of services. And across all three options is the renovation of our Freeport campus as well, and upgrades there. So this is, as I said, probably one of the most important pieces of work that we will be doing for the future with our friends at St. Mary's. And you'll be hearing more and more about this as we move forward. Diversity, equity, and inclusion is one of our key strategic priorities at the organization. And you will have seen in September the results from our survey. There's now more resources available on Lotus Link when it comes to diversity, equity, and inclusion. And there's also more resources that are available from the Canadian Centre for Diversity and Inclusion as part of that. I would really encourage you to use these resources to educate yourself. What I find, from speaking from my own personal point of experience, what I'm finding is every time I look into something, I learn more, and I feel grateful or thankful, I guess, that I'm able to do that, because it helps me to, I think, better understand the role I play, but better understand some of the beliefs that I've had, which are just quite wrong. And to share one with you is around the land acknowledgement, where I thought it was important to have one consistent land acknowledgement across the organization. What I've come to learn is what's actually more important is the research that goes into the development of that land acknowledgement by the person who's sharing it, and to have a true reflection around it. And so that was a piece of learning for me lately, and I'm grateful that I was able to learn that. So what's ahead for our organization, and it's not going to slow down. I'm sure many would like it to slow down, but the challenges and opportunities in front of us will continue to come. I think, as all of you know, at the end of this month, we will go through our next phase of accreditation. We, a couple of years ago, had our first phase of accreditation. This is the second phase. And through the various reports that I've been seeing, I know that there's a lot of hard work and effort that's been going into this. And I see this as really moving us to that point of everyday readiness, right? Which is really where we want to be for ourselves and for our patients, is that regardless of what day accreditation might happen, we'll be ready. And I do know that Accreditation Canada is moving to that in the not too distant future, where it will no longer be an event, but they will just show up. And they're already doing that in Alberta as an example right now. The recruitment and retention efforts and saying thank you, I spoke to that a little bit earlier. That will be a big part of our next 90 days for sure. The impacts and implications of our COVID-19 vaccination policy, working through that over the next 90 days for sure is something that we'll be focused on. Our COVID-19 recovery efforts, and this is primarily around how we help each other recover from the mental health challenges and stresses that came with it. What lessons have we learned as we've gone through COVID-19 and continue to go through COVID-19? And then making sure those who have had care delayed, we start to address that for them. No illusions that this will be done within the next 90 days or even within the next 6 months. Now, this is going to take probably well over 18 months for us to effectively go through the recovery phases from COVID-19. And part of those recovery efforts are advocating with Ontario Health and with the Ministry of Health to keep the majority of the resources that we currently have in place post COVID-19. So the best example would be the large number of beds that we've opened since the beginning of COVID-19. In the year prior to COVID-19, we operated 495 beds. Right now, we're operating about 650 beds. And our advocacy efforts are around keeping those beds open because we know they're required in this community. And then, of course, what comes with those beds are the human resources that we need to support them. I talked about our strategic plan official launch in my memo last week. It's something we are moving back. We still continue to operate under that umbrella, but wanted to make sure that we're spending the time in, I would say, those 4 earlier bullets right now, as opposed to spending our time on the strategic plan. And we're also into our operating and capital budgeting process, and that's a multi-year process. And that began in September, and that will continue for the next number of months as well. So with that, I would turn to where I started, and which is where I want to end, which is saying thank you. I know these are not easy times for anyone. I know that there is a lot happening, and there has been a lot happening over the last 18 plus months. And your efforts have been nothing short of remarkable, and I thank you for that. And with that, I'm going to turn it over to questions. So if I can ask, I'm not sure who from the comms team was keeping track of our questions, but if I can call on one of you to maybe ask them, and then if I have the answer, I will try and respond. And if I don't, I will turn to the senior team members who probably have much more insight than I do around it.
Hi, Ron. I have some of the questions here. So
Great,
let me
Julie.
start with the first one here that we've received. Will non-compliant staff be terminated November 9th or continued on unpaid leave? I understand staff on leave cannot be replaced.
Okay, I'm going to turn to Jennifer because, and Jennifer O'Brien is our VP of People, Communications and Engagement. So, and I think she's on the call today. Maybe she's not. Cassandra, is Jennifer in the participants list?
Hold on. Yes, I just was muted. I couldn't talk.
And there you go.
There, sorry.
You're muted again.
All right. I think I can talk. So the policy is that staff who are not vaccinated by November 9th will, the employment status will be reviewed. For the majority, that means that they will be terminated, but we look at each individual circumstance. And so we don't say across the board, but for the majority, yes, it will mean by November 9th, they will be terminated.
Thanks, Jennifer. The next question, Julie.
Okay, so the second question we have here is, what steps have been taken to address lack of representation of diverse, equity deserving populations in positions of authority at GRH? How are we moving forward on EDI initiatives? And how can employees be involved in this work?
Okay, so a great question, and don't go too far, Jennifer. You know, what I would say, and I'll start at the board level. You know, our board of directors in their last recruitment of new board members actually had diversity, equity, and inclusion as one of the most important criteria, even before getting to skill set. And I think they did a great job in doing that. And that shows leadership. You know, from an organizational leadership standpoint, so at the senior team, it is one of the criteria that we have as we look for new members to join our organization. And that is not just around visible diversity, but also diversities of, you know, of gender, diversity of sexual orientation, you know, and it's how do we open our lens around that? And it is a regular area that we are paying attention to as we recruit for vacancies in our organization across leadership. How you can get involved and some of the other efforts, I'm going to turn that over to Jennifer.
Yeah, so I'd also add for with the leadership positions where we've changed some of the channels that we're advertising to try and reach out to a more diverse group of applicants. So that is something that's happened. And we are always ensuring that we have someone from a diverse group in the interview panel so that we get a complete picture of the candidate and gets the right questions asked. So that is two things that we've changed. If people want to get involved, we have the Diversity, Equity, and Inclusion Advisory Panel that provides advice to the Diversity and Equity Inclusion group. So if you are interested in participating in that, if you can email myself and I will make sure that those names get put forward.
Thanks, Jennifer.
Okay, next question we have here. Why are potential candidates not getting calls when we are in such a shortage of staff? How can we as GRH staff assist to escalate to get new staff on board?
Okay, Jennifer.
So I'm not aware, and I think Lee is also on the call, but we we do reach out to people who are qualified for positions. It doesn't necessarily mean that every applicant that applies will get a response from Grand River Hospital. So it may be that applicants aren't qualified for the actual position, but we'll follow up. If there's someone in particular who feels that they were qualified, they should be reaching out to our Human Resources Department just to follow up on that. But it may be that for the position, we had more applicants who are qualified than were needed for the position.
Thanks, Jennifer. And you know, what I would add to the second part of that question, what can we all do as individual employees to help? As Jennifer said, you know, if that type of comment comes to your knowledge, make the HR team aware. And as importantly, you know, making your friends aware of the opportunities at GRH, right? You know, what's available, you know, welcoming them. I can tell you when I go to orientation every week and listen to our new employees, I would say at least 50% of them talk about how a friend of them made them aware of the organization, made them aware of opportunities in the organization. So my thanks to those of you that are already doing that. And I think that is one of the best things that we can all do, is inform our friends, encourage our friends to consider GRH as a place to grow their careers. Okay, Julie?
Next one we have is for our digital services team. Who are we supposed to contact about setting up our WebEx account?
Okay, so this I definitely don't have the answer to, but I'm hoping Sven Beil, who's our VP, there he is. He can answer that question.
Good morning, everyone. Thank you, Ron. Good morning, colleagues. We are indeed moving from Zoom to WebEx. Colleagues will have seen over the last couple of weeks some communication about that, and there will be more communication coming forward about how we set up our WebEx accounts. But for those of you who want to get a jump on things and to start using WebEx, you can call the help desk. The help desk is well equipped to help everyone set up WebEx accounts. And if you have further questions, then definitely the help desk can direct you to our support staff. We have 2 support staff who are going to be working alongside departments and those who are going to be helping us with that transition. And of course, one of the benefits of WebEx is that in a number of identified meeting rooms on both our campuses, our meeting rooms will be equipped with WebEx equipment, which will allow us to have in-person meetings and video conference meetings and really improve our communication ability and our ability to work together. So thank you so much for the question, and the help desk is always here to help you.
Thanks, Sven.
And our last question here, we did also receive some questions about vaccinations. Those will all be addressed in tomorrow's virtual panel, so I encourage you to attend if you do have any questions in that regard. But our last question will be, what will be involved in the Freeport renovations? Will this result in a change in the services and programs provided?
So there, you know, I'll let Bonnie Cam speak to the clinical services priority planning that's happening now. As far as the specific changes that will happen at Freeport, that will be identified as part of the whole master planning process. So I would say that hasn't yet been landed on. But Bonnie, I don't know if you want to talk about the clinical priorities planning work that's being done.
Yeah, sure. I'd be happy to. Thank you, Ron, and good morning, everyone. So you may be aware that we've been working in the background on our overall strategic plan, and in alignment with that, a Grand River clinical services plan. And so really this is about both across all of clinical to focus on what is it we're working to achieve, but also across the programs, what is it that each program will be focusing on over the next 3 to 5 years. We're not starting that work. We're doing some background work right now. We're not starting that work with the clinical teams. And we do want to ensure that there's engagement from the front line, and the teams are coming forward with the ideas and the thinking around where we would like those programs to be. But it will also be looking at where or how do we evolve our programs? What are the key services we need to extend to support our population and our community? So all of that work is being planned out right now, and not to start until we get into November. So that's forthcoming, and there may be some alignment with Freeport, with KW in terms of how we look at our services, but that's really been yet to be determined. And that's not only to support our strat plan, but as you've heard today, to support the master planning and where we'll be from a population, as well as from a focus on various different disease states, et cetera. Thank you, Ron.
Great, thanks, Bonnie.
Can I just
And
clarify? Sorry, Ron, can I clarify? Tomorrow's meeting for the panel is about vaccine hesitancy. So if people have questions about the actual policy, we will take them today. And tomorrow is about questions about the vaccine and whether people are concerned about taking it. So it's not about the policy itself.
okay, thanks for that. Okay, and then I saw there was a question about who to contact about updates on the website, and I see that Julie has responded to that, and comms is the contact area if you want to update your departmental listing. So with that, thank you, Julie, for sharing summarizing the question. My thanks to those of you on the senior team for your help in responding to those. And again, my thanks to all of you who took the time to join today and to share your questions. And again, ending on with, again, a thank you for all that you've been doing to positively impact people's lives throughout our region and inside our walls. Have a great day and stay safe.